Hello and welcome to Pancreatic Cancer Warriors. I'm Dr. James, and today we're going to delve into a critical aspect of this disease that profoundly impacts a patient's daily life: how pancreatic cancer affects digestion and appetite. Many patients and their families are often perplexed and distressed by the rapid, seemingly unstoppable weight loss and the complete loss of desire to eat. It's not just a side effect, it's a direct consequence of the cancer's insidious strategy. Understanding this process is the first step toward managing it, empowering you with the knowledge to fight back effectively. We'll explore the science behind these symptoms, making the invisible processes happening inside the body visible and understandable. This is a battle fought on multiple fronts, and today, we're equipping you with the intelligence needed to navigate one of its most challenging terrains. Pancreatic cancer wages a devastating war on your body, and it initiates this conflict with a calculated, two-pronged attack directly targeting your digestive system. This isn't a random assault. It's a highly effective strategy that involves both a mechanical blockade and a metabolic hijacking. Imagine your pancreas as a sophisticated factory, tirelessly producing essential digestive enzymes. This factory has a critical delivery route. The pancreatic ductat transports these enzymes to the small intestine, where the real work of breaking down food begins. The first prong of the cancer's attack is to physically obstruct this very route. As the tumor grows, it can press on, squeeze, or even completely block the pancreatic duct. This creates a physical barrier, a dam that prevents the vital flow of digestive enzymes from reaching their destination. It's a direct, mechanical sabotage of your body's ability to process the food you eat. The second prong of this attack is far more subtle, but equally destructive: a metabolic hijacking. The cancer doesn't just physically interfere with your body's functions, it actively rewires them for its own benefit. It releases a flood of inflammatory molecules called cytokines into your bloodstream. These are not just random byproducts. They are powerful signaling agents that travel throughout your body, creating a state of systemic inflammation. These cytokines act like misinformation agents, disrupting communication between your organs and your brain. They specifically target the appetite control centers in your brain, sending persistent signals that suppress hunger and create a profound sense of fullness, even when you haven't eaten. This induced loss of appetite, known medically as cancer-associated anorexia, is a deliberate manipulation by the tumor to weaken its host. The cancer is essentially commandeering your body's own communication systems, turning them against you to ensure its own survival and growth at your expense. This combination of a physical blockade and a chemical reprogramming creates a perfect storm, leading to severe malnutrition and a rapid decline in physical strength, which are hallmarks of the disease. Let's look closer at the consequences of that mechanical blockade. The pancreas is responsible for producing a powerful cocktail of digestive enzymes, including lipase to break down fats, protease for proteins, and amylase for carbohydrates. When the tumor obstructs the pancreatic duct, these enzymes are trapped within the pancreas and cannot be released into the small intestine. Without these essential tools, your digestive system is rendered powerless. It's like asking a construction crew to build a house without their hammers, saws, and drills. No matter how much high-quality material, or in this case, nutritious food you provide, the work simply cannot be done. Your body is unable to properly deconstruct the complex molecules of fats, proteins, and carbohydrates from your meals into the smaller absorbable units of fatty acids, amino acids, and simple sugars that your cells need for energy and repair. The food travels through your digestive tract, largely intact, its nutritional value locked away and inaccessible. This failure to break down and absorb nutrients from the food you consume is a condition called malabsorption. It is a central and devastating feature of pancreatic cancer. From the outside, it might seem like a simple matter of eating more, but the cruel reality is that even if a patient manages to eat a full, calorie-dense meal, their body is incapable of harvesting the nutrients within it. The vital energy, vitamins, and minerals pass straight through the system, unabsorbed. This process effectively starves the body's cells, even in the presence of food. This is the mechanism behind the characteristic, dramatic, and often alarming weight loss seen in many pancreatic cancer patients. The body, deprived of its primary fuel source from food, begins to cannibalize its own tissues for energy, breaking down fat stores and, eventually, muscle mass. This condition, where the body wastes away, is known as cachexia. It's not just simple weight loss, It's a complex metabolic syndrome that involves a systemic inflammatory response, leading to profound weakness, fatigue, and a significantly diminished quality of life. The patient feels exhausted, not just from the cancer, but from this deep, cellular-level starvation. One of the most direct and telling signs of this fat malabsorption is a change in the patient's stools, a condition known as steatorrhea. Because the enzyme lipase is blocked from entering the intestine, dietary fats cannot be broken down or absorbed. This undigested fat must go somewhere, so it passes through the intestines and is excreted in the feces. This results in stools that are distinctly different from normal. They are often bulky, have a greasy or oily appearance, and are foul-smelling. They may also appear pale in color and tend to float in the toilet bowl due to their high fat content. While it can be an uncomfortable topic to discuss, recognizing steatorrhea is critically important. It is a direct, visible confirmation that the body is not absorbing fat. This symptom provides crucial information to the medical team, often prompting them to prescribe pancreatic enzyme replacement therapy (PERT). PERT involves taking capsules containing the very enzymes the pancreas can no longer supply, helping the body to break down food properly, absorb nutrients, alleviate the distressing gastrointestinal symptoms, and fight the debilitating weight loss. Beyond the physical obstruction, pancreatic cancer masterfully manipulates your body's internal chemistry to suppress your desire to eat. The tumor itself is a metabolically active entity that releases a barrage of inflammatory substances, most notably the cytokines we mentioned earlier. These molecules, such as TNF-alpha and interleukin-6, circulate in the bloodstream and act as powerful messengers of distress. They cross the blood-brain barrier and directly impact the hypothalamus, the region of the brain that regulates hunger, thirst, and body temperature. These cytokines essentially trick the brain into thinking the body is constantly under attack from an infection, triggering a sickness response. A key part of this response is the suppression of appetite. This is why when you have the flu, you often don't feel like eating. The cancer exploits this ancient, hardwired survival mechanism for its own sinister purpose. It creates a chronic state of inflammation that perpetually signals to your brain to shut down the drive to eat. This profound loss of the desire to eat, medically termed anorexia, is a very different phenomenon from the eating disorder anorexia nervosa. In the context of cancer, it is not a psychological choice but a physiological command issued by the cancer itself. Patients often describe it as a complete absence of hunger, or even a feeling of revulsion at the thought, sight, or smell of food. Even favorite dishes can become unappealing. This isn't just a matter of not feeling hungry. It's an active suppression of one of our most fundamental biological drives. The combination is devastating. Malabsorption means the body gets no value from the food that is eaten, and cancer-associated anorexia means the patient has no desire to eat in the first place. This two-pronged assault starves the body, weakens the patient, and makes it incredibly difficult to tolerate aggressive cancer treatments like chemotherapy. Managing these symptoms is not just about comfort. It is a critical component of the overall cancer treatment strategy, helping to maintain strength, improve quality of life, and give the body the resources it needs to continue the fight. Thank you for joining me today at Pancreatic Cancer Warriors. Understanding the mechanisms behind these symptoms is a powerful tool in your arsenal. It helps you and your care team make informed decisions about nutrition, enzyme replacement, and other supportive care strategies. Knowledge truly is power in this fight. I'm Dr. James, and I look forward to seeing you in our next video. Stay strong.